In this lecture, we will be talking about the different employment settings in which mental health counselors can practice their craft. To begin, let's talk about the beginnings of mental health. Community mental health centers are a direct result of the Community Mental Health Center Act of 1963. During the 1950s, there was a considerable push in the nation's government to create a better standard of care for those individuals receiving mental health treatment. Under the direction of then-President John F. Kennedy, the government was looking for ways to deinstitutionalize the mental health treatment protocol. Instead of locking patients up and isolating them in inpatient psychiatric treatment centers, the goal was to provide more community-based, outpatient-focused treatment. To make this vision become a reality, the Community Mental Health Center Act provided funding for local communities to establish mental health centers. Rather than funding statewide psychiatric institutions, the funding was instead directed to local communities to provide treatment centers. This change was met with mixed results. While it deinstitutionalized many patients and allowed them to receive care in their community, and certainly opened the door for treatment services to many individuals who otherwise may not have qualified, there was still a concern that many of the hospitalized or institutionalized clients who were now free and seeking outpatient treatment were not receiving the care they needed. These mental health centers oftentimes were understaffed or were dealing with clients whose issues went beyond the scope of practice and expertise of their staff members. So there were some positives and negatives to this approach, but mainly it established the way we think of community mental health treatment today. As a result of this act, each of the 50 states divides itself up into distinct catchment areas. These catchment areas serve as regional districts that define the population served by a particular mental health agency. In Mississippi, we have 15 different catchment areas, and a local community mental health center is located in each of those 15 areas. Lauderdale County is in District 10 and is serviced by Weems Community Mental Health Center. According to federal regulations, community mental health centers must provide the following types of services: outpatient treatment, inpatient treatment when deemed appropriate, consultation and education opportunities, partial hospitalization or day treatment programs, and emergency interventions such as crisis management or after-hours care for emergent issues. In establishing how these services will be provided, all community agencies operate under the same basic goal. This goal is to assist the largest number of people in the most efficient and cost-effective way. For some catchment areas, where populations are more dense, a large number of clients need to be serviced. In more rural areas, there may be less population. Clients may be spread out. So the types of services that are offered will vary from area to area depending on the needs of the constituents in that catchment area. In establishing what the needs are, Mental health centers conduct needs assessments. These needs assessments allow them to gain a snapshot view of what it is that the community is requiring and what would most benefit the individuals residing in that community. A needs assessment definitely occurs before services are provided when mental health centers open, but it's also a good idea for needs assessments to be conducted on a periodic basis. Shifts in demographics, community climate, economy, and job changes may create challenges that were not prevalent before. As a result, the needs of a community may change. And so it's beneficial for mental health agencies to keep current with the services they offer by making sure that they are in touch with what the true needs are of the population at a given time. So how are these agencies funded? Well, in 1981, Congress changed the way that community mental health centers receive federal funding. Going forward, states would now receive what are known as block grants to support their state programs. A block grant is a collective sum of money provided to the agency with very little government oversight into how it should be spent. The only stipulation is that the money be spent on activities and programs that are geared towards meeting the goals of that agency or mental health center. Unlike category grants that have itemized budgets and line items for each type of service, in a block grant, the individual agency gets to decide how best to spend its resources. What types of programs and interventions are most likely to meet the needs of its constituents and achieve the goals established by the center. Block grants only provide partial funding for these agencies, and as a result, additional sources of income are needed to offset the cost of providing the services. Additional funding comes from several other sources. Medicaid and Medicare make up a large portion of the income from community mental health centers. Many of the clients that they see are receiving government assistance, and these government programs help to fund the services provided. There may also be funding through government subsidized programs, whether they be grants or programs designed to treat a particular illness or deal with a particular community event or activity. An example of a special program or government special subsidized program would be the National Mental Health Screening Days that occur. Because these are federally authorized activities, funding is provided to local mental health agencies to help cover the cost in terms of personnel, materials, and advertising for community health screening days. If we were to categorize the services provided by community mental health centers, we could look at the community counseling model to help identify how services play a role in helping the community. According to the model, there are 4 different types of services: direct client services, indirect client services, direct community services, and indirect community services. Direct client services are those services that address an immediate need of the client as well as the people identified at risk for developing future mental health problems. These are the activities we have in which we work with individuals. Those that have current problems, ongoing issues, and those first diagnosed or first preventing for services. Many of the traditional counseling interventions and activities that we think of fit in this category of direct client services. Some examples include outreach or crisis intervention, and the various forms of counseling, whether we deal with the individual client, work in a group, or do a marriage or family setting. Indirect client services refer to environmental interventions. Here the goal is to meet the needs of people in vulnerable populations. These may not be individuals who are actually presenting for services. What we're doing here is more preventative work, more upfront work that helps a certain population lessen the need for services by addressing their needs before they become problematic. Services here include advocacy and referral. For example, we can advocate for a certain population, whether it be increased knowledge, anti-stigma, availability of services. We are creating a situation in which clients will have a more conducive situation for meeting their needs. Direct community services are those services provided to the community as a whole. Here we're looking at educational experiences. Frequently you will see mental health agencies offer programs to the general public. These programs are usually offered free of charge and serve as a great community outreach project. Parent education programs, stress management programs, or conflict resolution workshops are but a few examples. In our catchment area, our local mental health provider, Weems, offers several community outreach programs, particularly through their Children and Youth Services division. Indirect community services are efforts designed to make the environment more responsive to the needs of the population as a whole. These are more of our global scale initiatives. Examples include public policy, lobbying for change, educating policymakers. Currently, the American Counseling Association employs lobbyists who are working on Capitol Hill in Washington to include counselors as authorized providers of services for Medicaid and Medicare. The goal here is to increase the number of individuals who are able to help those vulnerable populations in need of services. By changing public policy, counselors now become available as a service option for a large number of people. To see how these services look, we can illustrate using a 2x2 grid. We see that direct client services in the top corner here is reflected by counseling activities. Indirect client services are advocacy efforts at the local or grassroots level. Community direct services or workshops. And indirect community the more global efforts are public policy changes. Within these 4 different areas, several services can be provided. Among the many services that clinical mental health centers provide are outpatient counseling services, day programs, emergency services, substance abuse services, case management and outreach, education and consultation, residential programs, both long and short term, and inpatient services, whether it be a psychiatric hospitalization or hospitalization in a local hospital for evaluation and medication check. The need for these services becomes greater every day. There is a rising need for community mental health center treatment options and agency offerings. According to a national study, in 1999, 2% of the U.S. population had been diagnosed with mental health illness and was receiving mental health treatment. In 2009, that number rose to 2.7%. While 0.7% may not seem like a lot, it actually equates to a little over 2 million people. So in the past decade, over 2 million more people were being diagnosed and treated for mental health illness. In addition, the prevalence of mental health disorders is much higher in the United States than it is in other countries. For example, in the United States, there are 12 times more children diagnosed with ADHD than there are in Europe. As more people seek treatment, mental health agencies become more valuable parts of the local community. Some of the issues that mental health agencies and mental health counselors now deal with are personal issues, helping people deal with their everyday struggles, stresses, anxieties, job changes, job loss, relationship issues. Psychopathology, those being diagnosed with mental illness who may need more acute care, may require psychiatric intervention and medication, crisis intervention, suicide assessment, and advocacy. Due to staffing shortages and funding limitations, advocacy becomes an important issue for mental health agencies, as these outreach initiatives have the ability to impact a larger group of people than individual services may. We also could look at mental health counselors playing a role in career development. As the economy changes and the workforce changes, career counselors are becoming more and more vital in today's society. As such, career development agencies, which hire career counselors to work with individuals and with companies that are hiring to be more productive in their efforts. In sum, career counseling can be seen as a process of assisting individuals in the development of a life career with focus on the worker role and how it interacts with other roles. So helping individuals to integrate their career or their work life into the total picture of who they are as an individual. Career services that can be offered are education, information, intervention, and coaching. Counselors may need to help individuals learn more about the world of work, explore the possibilities available to them, identify their skills and abilities, assist them in preparing for a career in a new field, and helping them to gain meaningful and valued employment. Career counselors also work on career goals and strategies, finding out what it is that the individual wants to do and how they could achieve those goals. They also work with employers. How can employers maximize their efforts to ensure that they get top quality employees that are productive and satisfied with their employment? By creating an environment that is conducive to productivity and satisfaction, companies are less likely to experience worker turnover and declines in profits and productivity. Within the career counseling realm, the community counseling model can be applied. Direct client services may look like resume writing or career exploration assessment with clients. Direct community services may be working with agencies and companies on hiring practices. Indirect client services may be job training offered to the community. And indirect community services may be changes in the hiring practices of companies, changing the policies to ensure that equality and opportunity is available, working with companies to make sure that they meet federal and state standards related to workers with disabilities, whether they be physical or mental. Counselors may also work in hospital or healthcare settings. Inpatient medical settings exist. Counselors can work in hospitals, providing mental health consults for patients hospitalized for physical ailments, continuing care that they may have received outside of the hospital. They may also work in psychiatric settings. Counselors often are employed in medical clinics, cancer care, hospice units, or emergency room settings. Prior to my academic career, I had an opportunity to work as an emergency room assessment specialist. My job there was to assess any individuals who presented to the emergency room with psychiatric or substance abuse related issues. This included both clients who voluntarily presented, as well as those who were brought in under court order or under police custody. So several different opportunities are available for counselors to work in the healthcare field. Many mental health counselors also consider working in alcohol and drug-related settings. In these substance abuse centers, emphasis is placed on the Minnesota model of chemical dependency treatment. The Minnesota model is based on the premise that alcoholism is a disease, and the treatment for alcoholism should be similar to what we would do with other diseases or physical ailments. Different services provided for those with substance abuse issues include detoxification. For certain substances, a detox period is required, as there can be some physical complications from coming off of a substance. For some, there really isn't a defined need for a detoxification period. While it may be difficult psychologically for the individual to give up a substance they've been using or abusing continuously, there's not a medical risk in doing so. Once past the detox period, residential treatment may be an option. You may be familiar with the 28-day programs. While this length of treatment is becoming more and more rare, residential treatments are still offered, sometimes at a week or 10-day length. Outpatient treatment, partial programs, day programs are available, as are aftercare plans. More individualized counseling approaches to help individuals deal with managing their environment, their stressors and triggers related to their previous substance use and abuse. At these types of facilities, 12-step plans are emphasized and promoted, helping individuals to understand that they are powerless, that a higher power is at work here, and making the changes, working the steps one at a time to maximize the likelihood that their remaining clean and sober is a lifelong success. Counselors also may work in corrections and probation settings. Prisons are now hiring counselors. In these settings, they're referred to as custodial officers, and they attend to the mental health needs of an inmate population. In some settings, the counselors not only work with prisoners, but they also work with staff, the guards, facility personnel, even the administrators, almost acting as an employee assistance program. And so that leads us to employee assistance programs. EAPs, as they're commonly referred, are becoming more and more prominent. They serve as a great way to provide services to a large number of individuals. Approximately 15,000 EAP programs are in effect throughout the United States. Master's level counselors are a great resource to fill the needs of these EAP programs. What EAP programs do is establish a mental health network or service directory for employees and their families at different corporations. These corporations or businesses contract with an EAP provider. That EAP provider may work exclusively with that company in-house, or it may be on an outpatient basis. The EAP providers are reimbursed and prepaid for their services by the company. This prepayment enables employees and their families to seek services free of charge. Companies negotiate with the EAP provider to come up with a cost of providing services to the employees. Activities that EAP providers do are individual sessions, Typically, individuals are allowed 3 to 5 sessions, whether it's employee or a family member, of individual therapy. Group therapy may also be established. And company-wide initiatives also are undertaken by EAP providers. Workplace safety, stress reduction, or stress management workshops may be conducted by EAP providers. The first EAP programs began in the late 1960s, early 1970s. And one of the first companies to offer a full employee assistance program was International Business Machine, also known as IBM. Today, many of the Fortune 500 companies offer EAP programs and view them as an excellent expenditure, for it increases productivity, worker satisfaction, worker health, and contributes to the community as well. Like the others, various community counseling model services can be used in an employee assistance program setting. Direct services may be the actual sessions and counseling scheduled with the employees. Direct community services may be the workshops provided to the company. Stress management workshops for employees. Indirect client services may be advocating on behalf of clients. Talking to management about strategies or policies that could be in place to improve worker morale or worker productivity. And finally, indirect community services, working at the more global level to change how it is that companies and organizations provide services to their workers. This could include advocating for more funding for EAP programs, extended services for families and dependents. These that we've discussed are but a few of the settings in which clinical mental health counselors can find gainful employment. Additional settings include private practices, where you could open your own clinic or setting, domestic violence shelters, working for the insurance companies or HMOs, working in college and university counseling centers, and working in the elementary and secondary schools. Many schools now are hiring mental health professionals to come in and address the more severe or chronic illnesses their students face. While school counselors deal with the more day-to-day issues, mental health practitioners come in and deal with the more pathological issues. Mental health agencies also send counselors into the schools to follow up and case manage those clients who they see on an outpatient basis. So the opportunities available to you as a clinical mental health counselor are quite varied. As you go through your program and learn more about the profession, hopefully you will identify populations, settings, or presenting issues that you find challenging and intriguing, and which you could see yourself working with in the future. Once you identify these interest areas, you could then see which type of settings would allow you to work in that type of environment. These settings then may be those that you seek out in your practicum or internship experiences to gain more first-hand knowledge and a working understanding of what it will be like to serve these types of clients.